Everyone, and welcome to another RAMS Fast-15. Go ahead and advance it. I'm Dr. Andrew Starnes, president of SAM RAMS, and I'll be your host. The Fast-15 is designed to give you critical content you need in 15 minutes flat. Today's goal is to provide information to help you navigate physician employment contracts as you enter the EM job market. And you can advance again. Today's topic is physician contracting. It's hosted by SAM RAMS and the SAM Industry Advisory Council. Members of SAM Industry Advisory Council are Atlantic Pension Planning, Apollo MD, Leading Edge Medical Associates, Integrated Emergency Services, EM Recruits, Integrated Wealthcare, and Envision Physician Service. I encourage you to visit IAC member websites for additional professional development resources. The clock is ticking, so let's jump right in. I'd really like to introduce our speakers. Today we are very happy to have with us Bruce Armon, who is chair of the Health Law Practice Group at Saul, Ewing, Armstein, and Lair. And we also have Michael Silhol, attorney with Silhol Law. Thank you both for being with us. We're happy to have you and your expertise.
Pleasure.
So the key topics that we're going to be discussing today regarding physician employment contracts are major contract issues, salary options, non-salary benefits, and agreement termination. Specifically, let's start out with major contract issues. We're going to kind of skim through some of the major topics that come up with this, knowing specifically the financial terms of your contract, like compensation, being aware of the details, and the importance of fair market value in establishing compensation. To start out, let's go to you, Bruce, first and get your take on these important points.
Sure, and Dr. Starnes, thanks for having me today. I look forward to presenting with Michael. I think one of the big takeaways, given the limited time that we have today, is our goal is to allow you to continue to be an excellent physician and to hopefully make you a better business person. And one of the business person aspects that you need to understand is your employment contract, whether it's your first contract or your 10th contract, whether you're the employee or one day you're the employer. Understanding that the contract needs to tell a story. Every paragraph, every sentence, every word means something. So as a respect to the major contract issues, think about compensation, something that all of us are very concerned about, but also be aware it's not just your salary. It could be the level of benefits that you might be provided. It could be the health insurance plan you get, or the retirement plan, or the tail insurance, or the moving expenses, or the signing bonus, or the loan forgiveness programs. As I alluded to before, be aware of the details in the contract. As Michael and I can attest, every word means something in the contract. And if the employer had an attorney put it together, you should make sure you understand every word in terms of what it means, what it's about. And if you don't understand it, ask questions or ask somebody on your behalf to ask questions as to what it means. If something's ambiguous, that does not necessarily work in your favor. And I'd always advise clients all the time to make sure you understand what you're signing. One of the components of the compensation piece is obviously fair market value in terms of understanding compensation. All of us want to get paid more, but there are certain parameters that certainly all nonprofit systems need to be aware of when they're hiring somebody. Even for-profit systems as a business, they need to understand sort of what the acceptable parameters are. And having as much information at your fingertips as possible so you don't make an outrageous salary demand is very important in terms of ensuring your credibility.
We'll go to you, Michael, and get your take on these.
Sure, and I would follow up on Bruce's excellent points, especially on the compensation side. It may need to go without saying, but I've worked with several physicians who have struck up deals with folks that they have felt comfortable with, but have failed to get those agreements in writing. And ultimately, at some point, the deal falls apart. And the doctor comes to me seeking to enforce the terms of an oral arrangement that they had with a business partner, somebody they thought was a partner. And unfortunately, because those agreements were not in writing, they're very difficult, if not impossible, to enforce. So be very careful, especially if you're doing an employment agreement or an arrangement with somebody that you consider a friend, a mentor, a neighbor, part of your family. Everything needs to be in writing. If it's not in writing, then unfortunately it cannot be enforced further down the road.
One follow-up question on this. Bruce, you specifically mentioned to just be aware of the details. I think you mentioned that twice. What do you guys think the first step is to really making sure that you're aware of the details of your contract?
I think in some respects, Dr. Starnes, it's being able to paint a picture and understand what's in the picture. You want to understand what you think you're getting, what you're actually getting, and what you'd like to get in the future, assuming that the employment arrangement works out for some period of time. So I always advise the physicians I work with, and I've helped hundreds and hundreds of physicians and hospital systems over the years, put yourself in a crystal ball. Where do you want to be 3 years from now, and understand that the contract, if it's properly drafted, protects the employer and the employee in providing a roadmap in terms of where you'd like your professional career to go. I often joke with many of my physician clients, particularly folks finishing residency or fellowship, that it's the first time in their career where they don't have to just say, yes, I accept the match that you're giving me and I'm looking forward to it. Depending upon supply and demand, depending upon where you're looking, you might have some more flexibility in what your contract options need to be. So you need to be a sophisticated consumer and understand what the market will bear and understand how you fit into the marketplace, and understanding what those details be can help go a long way.
So really read these contracts for starters, and really make sure that that more eyes than your own are going through them, and that really everything that's written there needs to be understood by yourself.
Correct.
Yeah, great. Thank you, guys. Let's move on to the next one. The next slide is really on salary options. And this is really getting down to knowing the details of your financial compensation options. Often this comes down to the base salary and then plus production or collections, production less overhead, and income guarantees. Michael, do you want to take us through this for the first round?
Sure. So there are going to be many components that make up your total compensation. What is going to be perhaps the largest component is your base salary. And we can talk a little bit later about the components that go into determining how your base salary is determined. But for most purposes, your base salary is typically going to be based on your productivity, which is usually computed based off of work RVUs. If you're not familiar with what work RVUs are, I would recommend that you understand them, Google the term, because for the course of your career, work RVUs are going to really be the foundation for determining how much money you make. Once you deal with your base compensation, then you can go off onto different avenues about what's built on top of that base. Sometimes you can have a productivity component, which, as I mentioned, is typically generated off of your work RVUs, or your collections, which are essentially what either the hospital or the practice group will bill and ultimately collect, again, based off of your productivity. Those agreements that deal with production less overhead, I would encourage physicians that go into these arrangements to have a good understanding of what overhead will be allocated to you. And oftentimes disputes arise over the improper allocation of overhead, where certain physicians don't believe that they should be assessed costs that more properly should be allocated to other parts of the practice or other physicians. And then income guarantees are a component as well that are often used for hospitals, especially that bring in new doctors into the area that don't have an established patient base, that may need help in getting their practice off the ground. And we can talk a little bit later too about how the income guarantee will relate to the prospects of you staying with that practice and what consequences may come about if you end up leaving that practice.
Gotcha. Thank you. Let's go to Bruce next and get your insight on these.
Sure. And I think Michael raised a lot of excellent points. I think one of the unique characteristics that emergency medicine physicians need to think about is you don't have the opportunity to select your patients. When somebody presents in the emergency room, you're obligated to treat that individual, no matter what their payer status is, no matter what their condition is, no matter how long it might take you to treat that person. So as you look at these different salary options, again, with the expectation all of us want to be quote unquote fairly compensated, you should probably get a realistic sense if it's anything beyond a base salary in terms of understanding what the peers in your group are actually getting in terms of compensation. It could be anonymized, so it's Dr. A or Dr. B, doesn't need to be somebody's individual name, but getting a sense in terms of how you're scheduled and what your shifts would be. If you work on a particularly busy shift, you might have more opportunity to have more productions or collections, depending on the way that's defined. If the hospital's not staffing it or your group's not staffing things in a way that you think is optimal and there's too much supply and not enough demand, you could have some downtime and that could impact your productivity or collection. So again, a well-written contract should clearly delineate what the productions and collections mean, what the formula is, to Michael's point, in terms of how it works. And there should be a level of transparency. So you're not surprised at the end of the month or at the end of the quarter or the end of the contract year in terms of how hard you think you worked and how much you think you're appropriately getting rewarded for those work efforts.
Great. Thank you both.
If I can just add one point too, especially in that day of COVID, if you have a compensation methodology that's going to be based on production, a lot of my clients who are ER physicians have seen a huge decrease in their salary because of the decreased volume of patients that have come through the ER in the days following COVID. And so this has certainly brought the issue to the forefront that many doctors are now asking for a guaranteed level of income regardless of volume seen in the ER due to circumstances beyond their control. And this is going to be a continuing area of evolution as we work through the COVID crisis.
Yeah, that's a great point. Thank you both. Let's move on to the next slide, which is going to cover our non-salary benefits. And for this specifically, we're talking about how salary is only part of the equation, and you want to ascertain the employer's flexibility and go through a few of the examples that we have there. Let's go back to Bruce. You want to take us through this one?
Sure, happy to. So the easiest way to think about this is imagine you have two different contract offers. One offers you paying you $50,000 more than the other. And intuitively, you might say, boy, $50,000 more, I can do a lot of different things with that. That contract that offered you $50,000 more might have all of your expenses come out of your salary, and they provide a claims-based professional liability coverage. The other contract, by converse, that pays you $50,000 less might include family health insurance, might include a retirement plan, might include long or short-term disability insurance, might include a recruitment guarantee or a retention bonus, and might include an occurrence professional liability policy and other things as well. And if you added up the value of all of those benefits, it would far exceed that $50,000 diminution in salary that you have. So the salary is certainly important, but don't let it be at the be-all, end-all, because an employer might have to quote unquote overpay to get you to join their practice or their community for reasons that might not be readily apparent to you, and understand how the package fits in together. If you're joining a nonprofit system, they're certainly going to have constraints on the way they can do things, and understanding what their mission is important. All of you as a professional, you want to understand the reputation of the employer that you're coming to work with. If it's a private practice, how long have they had the exclusive contract with the hospital? When is the contract next up for renewal? There's an old accounting phrase, LIFO, last in, first out. And if you're the newest person to join the practice and the practice for some reason is not renewed with its hospital for something that might be totally out of your control, and they need to make cuts or adjustments in their staffing complement, you might be the first person who has to have the opportunity to go look elsewhere. So, understanding that the salary is important, but it's not everything, and understanding sort of where your progression might be from year 1 to year 3 to year 5 can be really important in terms of mapping out your career.
Great. Touched on a lot of different important aspects there that I think that we probably gloss over as new grads, because it's so much easier for us to just say, well, what's the main number? Other thoughts that you have on this, Michael?
Yes, to follow up on some of Bruce's comments, the non-financial component of an employment agreement can be very onerous in some instances. So not just benefits, but also you want to look at potential obstacles. Many health systems, both for-profit and not-for-profit these days, have very rigorous conflict of interest policies regarding physicians. And especially if you're a physician that has outside interests. For example, you may want to do, if you will, a volunteer medical work in a clinic in an underserved area or even overseas. You may be writing and writing books or providing seminars Those types of activities, many times, and I'm seeing increasingly so, are being governed by the employer, even though you're doing them on your own time and without resources of the employer. And many employers are now demanding that they provide prior written consent before you do any of these activities. And with several of the physicians that I've represented, this has been, if you will, a deal killer, because these activities are very important to the doctor, but they're not allowed under that system's policies. So that's another item I would ask. It's not a benefit, but it's a potential obstacle that I'm seeing raised more and more.
Yeah, great points. Thank you both. I think that this slide in particular, it's just really clear that we often take as residents that are graduating too simplified a view, and you both have hit some really important things that we need to consider that don't come to mind to us sort of instinctually. The next slide that we're going to cover is when we actually maybe don't want to work there anymore, or something comes up and it is not desired that we continue to work at this job. So what happens if the arrangement doesn't work out, specifically with non-competes? And Michael, let's get your insight on this one first. Sure.
So when I talk with the doctor, it's an uncomfortable conversation at first, but it's one that I believe you have to have. And I tell all of my physician clients this, is what is your exit strategy? What's your plan B? With the physicians that I've worked with over the years, I would estimate maybe 25% to 30% of the deals don't work out. And these doctors many times will call me up 2 or 3 years later, sometimes sooner, saying, it's not working out. How do I get out of this? So going into the arrangement, I think it's always important for a physician to say, what's my exit strategy? And it's something that's an uncomfortable conversation, but I think it's one that you have to have. And as lawyers, it's our job to try to guide the physicians to what are reasonable ways for you to exit if this does not work out. One big issue in all the employment agreements that I see are non-competes. There are more and more agreements. Non-competes are governed by state law. So depending upon what state you're going to be going in will determine the enforceability of that and the scope of it. I'm in Dallas, Texas, and in Texas, we have very strict statutory guidelines about what must be in non-competes, but if those are in, the courts will enforce them. And so I encourage my physician clients to be aware of those, to, if it's a non-compete area within a certain mile radius, get out Google Maps, draw that mile radius, figure out where other hospitals or health systems are, and understand, what is in and what is not in play should you leave. So the other issue too are income guarantees. If you are recruited to a hospital system or a practice and they give you an income guarantee, which is essentially they guarantee your salary for either a year or 2 years, if your productivity does not meet certain thresholds and you end up with a debt at the end of that guarantee period, you can work off that debt by staying in that community for 24 to 36 months thereafter. What happens if you want to leave before you work off that debt? Many times hospitals and practices will then go after doctors to pay out these debts, which can be sizable and sometimes result in bankruptcy. As a resident or a fellow starting out in your career, you don't want to be looking at a bankruptcy matter because you did not want to stay in an area for whatever reason. So again, you always have to have an exit strategy and understand how you might exit an arrangement.
So have a good exit plan and make sure that you really have the logistics of it worked out. Yeah, that makes sense. And then Bruce, we'll get your 2 cents on these as well.
Sure. I think Michael raised a lot of good points. One of the things I often advise clients is, and it sounds counterintuitive, but think about the divorce before you get married. Your marriage is the employment contract, but as Michael said, things happen. Most of the physicians I work with, they've been wildly successful in everything in their careers to get to that point between high school, college, medical school, residency / fellowship. And once you're out in a working environment, it might be the first time where some people get exposed to a professional challenge that something's a little unfamiliar to them. And I've seen a number of circumstances where the employer just says you're not a good fit, and they ask you to move on, and be very cognizant, as Michael said, with respect to the non-compete. I think from a policy perspective, in addition to the state law considerations that Michael raised, there's very strong arguments to say, why should an emergency room physician have a non-compete? he or she's not in the position to attract patients to them. And if they want to go to a hospital across town, what's to preclude them from doing that? And in those circumstances, things like a non-solicit may become more relevant, where they want you to solicit other staff that you're working with or other physicians who you're working with, and then really cause to the detriment of your group or to the organization. But do understand how the non-competes can work. The income guarantees can be very attractive on the front end, but if for some reason the circumstances don't work out, be cognizant of the back end consequences for that. And the only other point I'd raise with respect to the non-competes, for any of the folks who are going to be watching this webinar who are in a two-physician household, if your spouse or partner is also a physician, be very mindful of the non-compete and the impact that might have on your necessity to have to move or relocate, and the challenges that causes to your spouse or partner's job, as well as with kids. And if you have to reload kids in a school district in the middle of a school year, is never ideal to do so.
Yeah, both great points. Thank you. We'll go on to the next slide, which is about consulting and professional. So whether it's your first time accepting a job offer or you've been practicing for years, considering a job offer can be exciting and stressful. It is highly recommended that you hire a physician-focused attorney to assist with contract review and negotiations. If you're at the early stage of residency, we would recommend that you begin saving money now in anticipation for this important step in your career. Being financially prepared to hire an attorney to assist in your contract review will reduce financial stress and ensure that you're in the best position to set yourself up for success in your career. One point that I would bring up on this is something that we often hear in emergency medicine is, well, these are shorter term contracts and often not as complicated because we don't have our own practices. So I would ask both of you that question. How do you respond to residents that say, well, I'm only signing for 1 or 2 years. The stakes aren't as high. I don't think that I need the services of a professional. We'll give that to you first, Michael.
Yes, I mean, even if a contract is relatively quote unquote simple, I've seen many instances where a lot can go wrong in a short amount of time. One thing, for example, that you'll want to look at that is most likely going to be contained in an ER physician contract is the ER physician's agreement to automatically resign their medical staff privileges upon termination of the contract without any due process rights or hearing or appellate rights that may otherwise be available to that doctor under the hospital's medical staff bylaws. And that needs to be carefully considered, because by giving away your rights to a hearing, potentially if you have to leave that practice under quote unquote suspect circumstances, you may get a National Practitioner Data Bank report made against you without you having any right to a hearing or the right to contest that because of your contractual rights. And this is an issue that we negotiate heavily many times with hospital-based physicians, including ER doctors. So that is one area that could potentially be very problematic.
Great. And then Bruce, do you have something to add there?
I think the only thing I would add to Michael's comments are, I have a client call me and say, this is just a 2-page contract. It's no big deal. And, it's easy enough to read. I think part of the challenge for the emergency physicians is to understand not only what's in the contract, but what's not in the contract. Because sometimes things that are not written or not addressed could have serious implications. If it's addressed in the policies and procedures somewhere that you don't take the opportunity to see, but you can be bound by those, you need to understand sort of how the whole package fits in terms of what you're looking to do and what it means for you. The only other suggestion I would have, if somebody would call me and say, Bruce, I want to go buy a house, can you help me? I'd say, listen, I can find the right person to help you. It's not really what I do, and you'd be better served by talking to somebody who focuses their time in the real estate world in terms of helping them do that. So, to the extent folks do look for an attorney to help them at whatever stage in their career they're in, they should make sure they're talking to somebody who understands healthcare law and understands sort of how the business of medicine works.
Great. Other points for professional guidance specifically, we would recommend knowing which type of attorney to hire, looking at their specialty, knowing what's included in the contract review process, and then avoiding hidden fees. Either of you have any points that you'd add onto this?
I would add, this is Michael, I would add, many times I get calls from physicians that ask me, how much I charge for a contract review. And that's a difficult question to ask or to answer. It's kind of like asking, how much does it cost for me to buy a house? It depends on how big the house is, where it's located. because many times when we, initially meet a physician and we don't know their circumstances, it's very difficult. So if you're a physician and you're, looking around for an attorney, I would ask them, what their hourly rate is, how many of these contracts they've negotiated before for physicians. Have they had experience working with that particular health system before, which can be very important. And then if you are looking to the attorney to help you negotiate terms rather than just doing a review, that's a much larger scope and you may expect to pay more. One thing too I'm finding more and more these days is I am getting into more data involving physician compensation, salary surveys, work RVU productivity levels, and providing that information to doctors, which can help them get a better financial package. And that's a larger review than just a contract review. So if you're a physician looking for an attorney, those are the questions I'd be asking. It's, if you're going to ask how much is it going to cost just to review this contract without showing the contract to us, that's almost an impossible question to answer.
Gotcha. Okay. Cool. Bruce, anything else?
I think Michael covered the main issues to consider. And so really just making sure, if you're hiring an attorney to help you, have that conversation with him or her and understand sort of what their expectations are, what their experiences are, and know what your expectations are. Some clients say, read the contract and please make sure I'm not getting taken advantage of, but this is the job I really want to take. I have other folks who have 3 or 4 offers they're considering, and they have a little more flexibility depending upon the timing of the cycle. And they don't necessarily have to take that job if they don't think every one of their realistic demands is fulfilled. But helping them understand their expectations can be important as well, so that everybody's treated in a professional manner.
Great. Well, we'll move on then to a few more Q&A questions. Actually, specifically, these are common questions that we hear a lot. And we'll start out with, we'll say, Bruce, you can take this one first. Can I shop around offers to different practice groups or hospitals?
Yeah, I think in a capitalist society, if you have an opportunity, if you have multiple opportunities, by all means, you want to get the best advantage for yourself. I would be very reluctant to say to hospital B, hey, I have an offer from hospital A, and identify hospital A and say exactly what they're giving. But you could say, listen, I have a competitive opportunity. Here's some of the things that this other employer was willing to offer me. I'd really love to come work with you, but what flexibility do you have in terms of matching or potentially long-term exceeding those opportunities? So again, if you have opportunities, if you're in your last year of training, you're gonna have more opportunities in October and November than you likely will in May or June in terms of finding the desirable job. But by all means, you want to get yourself situated in the best situation. Do it in an ethical, transparent way, but you have to look out for yourself first.
Great. And then Michael, I think the next question, you touched on this, so it's perfect for you. How is fair market value really determined for compensation?
Right, and thanks for asking that question. And it kind of is a nice segue from the shopping around question. As Bruce alluded to, normal market forces don't work necessarily in the healthcare field. Among us healthcare lawyers, we have a saying that if it makes good business sense, it's most likely illegal in healthcare. And that's because of the various laws, the anti-kickback law, the Stark law, you have nonprofit issues with the IRS, and which really, put guardrails around somebody being able to shop a deal. But what you can do as a physician is understand what the constraints are on your compensation, and that is fair market value. That is pretty much the guidepost by which hospitals and practice groups have to pay physicians. And fair market value is determined based, again, off of your work RVUs, productivity levels, salary surveys. And these are all items that are produced by consulting firms that have sprung up in a kind of a cottage industry over the past few years that advise hospitals and practice groups about where to set compensation levels. So instead of shopping around a deal between hospitals or practice groups, it may be better for you to understand how is the fair market value determined in this compensation package. And that's a much sharper and more strategic way to get a good package for you for overall compensation. But you've got to understand that concept of fair market value.
Great. And Bruce, did you have anything to add on that?
I think that was covered.
Perfect. Well, then we'll go to you at this next one then, Bruce. What happens if I leave the practice or hospital before my income guarantee period expires?
Another important question, and this goes to the financial wherewithal. If sign a 1-year contract that has a 2 or 3 year guarantee on top of that, and you leave sooner, understand what your responsibilities are in terms of either repaying that from sweat equity by staying in the community. Understand what the exclusions might be if the employer terminates you without cause, or you terminate the agreement for cause, or God forbid you become disabled. Is there still that obligation in terms of having those repayment obligations? But these can be very stringent, very severe, likely going to be attached with some sort of a promissory note, where if you decide to leave early and say, you know what, I don't like living in this community anymore, I'm going to move. You need to be very careful about your financial exposure you're going to have. You don't want to be in a bankruptcy situation at any stage of your career. You don't want your name to be besmirched with any other prospective employer because you skipped town and you had a significant obligation, because the hospital in those circumstances is making a significant commitment to have you be a part of the community. And the healthcare world is a very small community. There's not a lot of emergency room physicians. There's not a lot of hospitals, and administrators talk to one another. Emergency room physicians talk to one another, and your reputation can precede you. And you want that to be in a positive way, and not because you have a difficult reputation or left somebody hung out to dry.
Great. The next question, I think, ties in well with you. Actually listed several things on the non-salary compensation, Michael, earlier, and touched on this. Could you go a little bit more in depth to explain professional liability insurance options?
Yes, and that's an excellent point. And Bruce touched on this earlier. It's typically overlooked by physicians, but obviously it goes without saying, as any part of an employment arrangement, the employer should provide you with professional liability insurance, otherwise known as med-mal insurance. Certain states have what they call patient compensation funds, which sometimes substitute for liability insurance or are part of that. And that is very state specific. But regardless of which state you go to, understanding the liability coverage is going to be very important. It can be either what's called claims-based or occurrence-based. It's important for you to understand the difference between those two types of insurances. If it's occurrence-based, you do not need to purchase what's called a tail policy at the end of the end of your employment arrangement. If it's claims made, you must purchase a tail policy. And who purchases that tail policy is typically subject to negotiation. It can be quite expensive to purchase a tail policy. And when I'm advocating on behalf of physicians, I always advocate that the health system or the practice purchase that tail policy.
Okay. And then our final question that I'll float to both of you is, how do I best understand promotional opportunities and timelines?
Want me to take that?
That'd be great, Bruce.
Sure, happy to do so. So, I mean, obviously, everybody wants to be successful in their career. Understanding what sort of advancement opportunities might present, it's important to understand in the academic world, if it's a truly academic setting, what are the advancement opportunities in the professor ranks and what you need to do to achieve those things, and what type of things can be built into the contract to provide you certainty, to the extent any of us have certainty as to how to advance. To use a football analogy, you don't want anybody to move the goalposts on you in terms of what the expectations are. If you're going to succeed, you want to have every opportunity to succeed. Make sure you have the resources to succeed. In a private practice setting, depending on the way the organization's structured, what's the opportunity to become a partner or shareholder or a member? Is it based simply on the time that you've committed to the practice? Is it the fact that folks like you? Is it the fact that you're getting involved and engaged in hospital committee work? What is the precipitating factor? And then understanding with that advancement, does that mean an upside in compensation, or does that mean an upside in title, or a combination of the two in terms of what you can look for? Some people are quite happy to be a physician who handles their 15 to 16 shifts a month, doesn't have to think about anything when they're not working as it relates to their practice or their hospital setting. Other folks would like the opportunity to become more engaged or involved in their organization, be it a hospital or private practice. If you're one of those types of people, think about how you become involved, whether it's helping out on the IT side, whether it's helping out with the quality initiative measurements, whether it's helping out with the residency or fellowship program that they might have, and seeing where you can provide a value add and seeing that gives you additional opportunities in that practice setting.
Great. Michael, anything to add on that?
I think Bruce addressed it well.
Great. Well, thank you both so much. We'll move on to our next slide and just remind everyone that the members of the Industry Advisory Council ask that viewers visit the IAC webpage for additional professional development resources. This presentation will be available on the Industry Advisory Council's webpage on sam.org. Feel free to access it at any time. Thank you both so much, Bruce and Michael, for spending your time with us, for spending your expertise, sharing your expertise, and for the important work that you do on the behalf of physicians.
It's a pleasure to be with both of you.
All right, that is the last comment for this presentation. Thank you again to everyone for joining us and to our panelists for sharing your incredible insights and for helping SAM members navigate physician employment contracts a little bit better. Stay safe and be well.